Hey YouTube, I am coming to you today with a 33-week update. So I had a doctor's appointment yesterday and everything is fine with the baby. His heart rate was like in the 140s, which was odd for him, and I did ask if that was normal, and of course she said that that was fine, but I know it's normally like in the 150s, so he may have just been, asleep because he wasn't moving a lot during my appointment yesterday, but he was very active yesterday. And right now I'm just looking at, I have a list of things. I'm very anal when I go to the doctor, so these are all the things that I asked. So I've had a discharge that's different than what I have been having. So I spoke to him about that, and he checked me, and I have a yeast infection. So that's what that was. So I have a prescription for that. And the other symptoms that I have been having, some are, ongoing back pain, breast pain, and leaking. And I've also had a metallic taste in my mouth that he says is not due to prenatal vitamins, stool softeners, laxatives that I take. So he just told me to drink more water. That's the thing they tell pregnant women: drink more water. I also have a rash that I still have, but the cream that he prescribed me at my last visit does help with that. So still have that. I told him that sometimes I'm nauseous randomly. He said, don't worry about that as long as it's not an all the time thing. I'm sorry. Seems like my head's cut off or something. No. And also random numbness. Like sometimes when I'm standing, my legs just go numb, and it's really weird. And then if I'm sitting down, it's my arms. And he says that the baby's just probably sitting on pressure points. And also, a new thing since my last update: rolling over while at night, and sometimes when I get up, I have like a sharp stabbing pain in my abdomen. And I was like, am I going into labor? Are you serious? Are you really serious? Is this really what's happening? But it'll go away. And I'm like, okay. So I've been taking my time when I roll over in bed, trying, of course, if I'm just asleep and rolling, I can't do that, but I do try to take my time to figure out these things, and just to make sure I don't have that pain. And I asked him about it. He said it's round ligament pain, that the uterus is sort of like think of like a stand of some sort, and off to the side of the stand you'll have these support structures. So if the stand moves, the structures move. So that he gave me that analogy to help me understand that my uterus is here, and then I have these ligaments that are holding the uterus in, and since it's expanding, that when I move, my uterus moves, thus causing stretching on those support structures, the ligaments, and that's where the pain is coming from. And he asked me how long it lasted, and I said maybe about 5 seconds, and then by the time I get to some Tylenol, it's gone. So that was pretty much my doctor's appointment. I go back in 2 weeks, and I'll be 35 weeks at that point. So then I'll go back every week after my 35-week appointment. I did go and take a tour of the Women's Center, the labor and delivery part of the Women's Center. And I asked a lot of questions because I'm going to go to the childbirth class, the prenatal classes that they offer at the hospital. But the last class is on September 18th. And I am due on September 11th, and I really, really hope that I'm not that far overdue, that I can make it to that. So I just wanted to make sure that I would be able to tour the women's center and ask any questions that were necessary. So the questions that I asked were, I'm sort of new to the area that I'm delivering in, and where I'm from, we don't pay for parking at hospitals at all, which was totally new to me. And I go here and they're like, oh, you have to pay. And so anyways, to most people that is normal. For me, it wasn't. So I had to get used to that. So I wanted to know where the maternity parking was, if there was any. There's not. And I asked about where do I go? Where do I call? Excuse me. Where do I come when I'm in labor, if it's after office hours, and I go to the ER and get registered, and then they'll take me to the women's center. One thing that I really wanted to do that I'm unable to do, and I'm really bothered that I can't do it, is pre-registration. I cannot pre-register, and I don't like that, because I really want to be as prepared as possible, and if I could pre-register, I feel like that would just be so helpful for me, because I just don't know if my husband, he's just not good with forms and stuff, and I know I'll get upset and I just may go off. I don't want to be in pain with somebody asking me crazy questions that I could already do. So I'm trying to have them let me pre-register, because it just doesn't make sense to me. I just don't get it. But anyway, so what I'll have to do is, when I go into the ER, when I'm in active labor, I have to register in the ER, and then they'll call someone from labor and delivery, and they'll take me to labor and delivery. Sounds like the most crackpot, jacked up, ghetto foolishness ever, but if this is how they do it, I'm going to go with it this time. If I don't like it, I'm not delivering at this hospital for my next child. So that's my rant for today. Please excuse me. When I got to the women's center, a very lovely lady named Kathy showed us around and answered all our questions. She was really sweet, and I really appreciated her time, the time that she spent with us. And when we were coming in, we came through the back way, which I doubt we were supposed to do. And I really can't even remember how we did it. I think we got lost. And I saw this huge room. And just sort of offhanded, I said, why are there no people, back that way? And she said, oh, those are the newly renovated rooms, and we're just not full yet. We're not full right now, so we don't have people back there. And there is this huge room back there. And I said, what about that room, what was it, number 421? She said, oh, that's the suite. When you come in, ask your admitting nurse if anyone is in the suite. She said, if not, then, you can have that room. I was like, oh, word. Small random piece of information. But trust me, ladies, I will be asking about suite 421 when I go in, because it just looks more comfortable. It doesn't look dreary or anything. I didn't like the room that she showed me. That room that she showed me, that's the one she had to show me, because there was no one in there. But she said that this one would be renovated soon, but it just did not give me good feelings. I didn't have good vibes in that room. I was like, ugh. But okay, that's fine. That's about it. I'm gonna end this. I'll make this a two-parter because I don't want to go over 10 minutes. So I'll be back with part 2 in just a moment. Okay.